Hello, my name is Sekenny. I will be discussing manual sign language. So manual sign language is an unaided AAC system and that requires no external materials to the learner. It can be used alone or in combination with vocalizations, and it has been used with individuals with ASD since the 1970s. So manual sign language can be taught as almost an entire language, or different signs or gestures can be pulled from sign language, such as all done, help, more, for use with learners. So, as I just showed, to use manual sign language, the learner just needs her or his hands and to be able to orient themselves towards the individual they're addressing. Pause potentially to demand for their attention or to tap on them to make sure that person is paying attention, and then to use those signs. So situations where manual signs may be ideal include cases where the learner displays destructive behaviors. So if there's concern that a device or like a speech generating device or an iPad or PECs will be destroyed or used to potentially hurt another person, manual signs are a good choice. I once had a case where a learner had to have their iPad out for 2-3 weeks plus for repair, and having a few basic signs was helpful to be able to continue communicating with him during that time. They necessitate a basic level of fine motor skill, so for individuals with a great deal of difficulty making specific signs may be better suited by a different AAC. It's also well suited for individuals who already have family members that use sign language, because sign language is limiting in that it is only an effective method of communication for individuals who know sign language with individuals who know sign language. So it inherently limits accessibility to different community spaces and potential learning spaces and interactions with peers or other adults the learner may encounter in the community, which from a behavior analytical standpoint is a pretty large negative. Its beneficial use can also be as a supplementary method for PECs or SGDs, especially in cases where the learner has a difficult time carrying a device due to gross motor limitations, or a resistance to finding the device or binder, who have difficulty visually scanning a room to find the device they need. It can be a good way to give them some limited communication to either ask for help in finding it or to communicate very basic commands in situations where they don't necessarily need it.